So I don't know how many of you were around for the earlier presentation about clinical trials. In that at the end of that presentation, I talked about us all going to work. And what we wanted you to do is to take out your cell phone. So for those of you who weren't around earlier, if you could take out your cell phone, you got a cell phone, can you take it out? And what we'd like you to do, gentlemen, can we get your attention over there? Hello? We'd like you to take out your cell phone if you haven't done it before. Go to the subject line. Can we close the doors back there? We got to put you all to work. So we need you to take out your cell phone and go to the subject line and type in clinical trials. The purpose of which is that we're building a little community of the willing who want to help increase diversity in clinical trials. So if you haven't done it before, I need you to take out your cell phone, put in the subject line clinical trials, and up here is my email address, and I'd like you to send me an email. And if you send me an email, we're gonna reach back to you. So I'm going to now get our program started. Thanks.
And thank you, Dr. Puckrein, and good afternoon, everyone. I just want to make sure we have everyone back. Good afternoon, if you hear me. Much better. On behalf of Congresswoman Robin Kelly, Chair of the Congressional Black Caucus Health Braintrust, welcome to the 2017 Health Braintrust Awards Luncheon and Town Hall. My name is Brandon Webb. I am the Chief of Staff to Congresswoman Robin Kelly of Illinois, and I'm joined by Audra Wilson, the Deputy Chief of Staff to Congresswoman Kelly, all the way from Chicago, Illinois. Today we'll have a very critical conversation with 4 distinguished members of Congress on the state of minority health in America. But before we do that, we must celebrate a few leaders in the health equity crusade by awarding 3 awards: the Chairwoman Staff Leadership Award, the Corporate Citizen Award, and the Chairwoman's Congressional Leadership Award. So without further ado, I will turn to Congresswoman Robin Kelly to announce the recipient of this year's Congressional Leadership Award. Congresswoman?
Good afternoon. Receiving the Chairwoman's Congressional Leadership Award is my good friend and past chairman of the Congressional Black Caucus, the Honorable G.K. Butterfield. Congressman G.K. Butterfield is a lifelong resident of Easton, North Carolina. Raised in Wilson, Congressman Butterfield spent his formative years working tirelessly in the civil rights movement. Congressman Butterfield graduated from college and law school at North Carolina Central University in Durham, North Carolina. After earning his law degree, Congressman Butterfield founded a law practice and in 1988 was elected as resident Superior Court judge. In this role, he presided over civil and criminal court in 46 counties of North Carolina. For 2 years, he served on the North Carolina Supreme Court by appointment of the governor, and after 15 years of service, successfully ran for Congress. In Congress, Butterfield is a champion of affordable health care, a staunch advocate for innovative cures and clinical research, and federal programs that support low-income and middle-class Americans. Congressman Butterfield serves in the Democratic leadership as Chief Deputy Whip and is the immediate past chair of the Congressional Black Caucus. No easy feat. He sits on the influential Committee on Energy and Commerce and is the 4th most senior Democrat on the Health Subcommittee. A tremendously gifted leader and servant. Let's congratulate and actually say happy birthday to the Honorable G.K. Butterfield as he receives the 2017 Chairman's Congressional Leadership Award. Congressman.
Well, she let my secret out of the bag. Okay, all right, Robin. All right. How you want to do this? All
Look
right.
at the camera. Look at the camera.
Okay.
I didn't say what birthday.
I'll tell her.
I told him I didn't say what birthday it was.
Let me just begin by thanking you, Congresswoman Kelly, for your friendship, and thank you for your willingness to nominate me for this award, and certainly thank you for those kind and generous words of introduction. The fact of the matter is, on Thursday of this week, I will celebrate my 70th birthday, and I cannot wait. All of you who are 70 in waiting, it is not bad. And so it's going to happen this week whether I like it or not, and so thank you so very much. What she did not tell you was that her birthday is also this weekend on April 30th, but a different year. But let me, in all seriousness, thank you to the National Minority Equality Forum and to the Congressional Black Caucus Health Braintrust under the leadership of Robin Kelly. Thank you so very much for coming together each year to make events like this happen. We must do this, and we must do it with quality, and that's what I have seen today. And so thank you so very much, and thank you for the award. Let me just very briefly tell you that we in Congress are facing enormous challenges unlike any that we have seen in our lifetimes. We have been away from this place for the last 2 weeks, and we reconvened this evening at 6:30, and I do not know what to expect. One thing I do know is that the federal budget that we should be operating under is now operating under a continuing resolution. That's a technical term that we use in Congress. But our budgetary authority, the president's budgetary authority, expires at midnight on Friday of this week. And as of this moment, there is no deal for a continuation of the budget or the adoption of a 2017 budget. And so unless some reasonable minds can come together tonight and tomorrow, we may very well be facing a government shutdown at midnight on Friday night, and it will be clearly the responsibility of our friends on the other side of the aisle. Let's hope and pray that that does not happen. But what you must keep your eyes on is not the 2017 budget as much as is the 2018 budget. Under our procedures in the House of Representatives, we are responsible for initiating the budget. Under our procedures, the president sends over his wish list for a budget, a blueprint, if you will, for a budget. That's the beginning, that's the opening salvo for the budget. And when President Trump, a few days ago on March the 1st, sent over his budget, it was absolutely devastating for programs that we in the Congressional Black Caucus care about and programs that you care about as healthcare providers and allies. And you should be alarmed. In the House of Representatives and under the federal budgeting rules, you cannot increase spending in an account without a corresponding increase in revenue. And I say that to audiences all of the time, and sometimes audiences get it and sometimes they don't. And so just to make sure that all of you get it, I'm going to repeat that. There's only one way, one legal way to increase spending in one account without a corresponding increase in revenue or a corresponding decrease in spending in another account. That's called budget neutrality. It is a rule that we have to adhere to. And so, the budget that we received for 2018 includes a $54 billion increase in military spending. I am not opposed to our great military. The men and women in uniform do a wonderful job in protecting our country. But President Trump has asked for a $54 billion increase in military spending. That means that in order to pay for this increase, there has to be increased taxes, which you and I both know will not happen, or it has to be a corresponding $54 billion decrease. And so President Trump has opted to go for the decrease in non-defense discretionary spending. And that's where you come into play. because the spending cuts that the President of the United States has placed on the table and others that will be coming along from the Republican right wing and the House of Representatives will be devastating to programs that you care about. And so I give you that detail to let you know that this is pretty serious business. And what I'm talking about is imminent. It's going to happen soon. It's not going to happen next year. I'm talking about in the next few weeks to come. And so you certainly have to be engaged. The final point that I will make is that there's an idea on the table. There are many ideas on the table that are terrible, but one especially terrible that Congresswoman Kelly and I care so deeply about, and that is Medicaid. We were disappointed. We were angered by the fact that states did not expand their Medicaid program, 19 states, but let's put that aside for a moment. We are also upset because there's a concept emerging of block granting the Medicaid program and giving block grants to the states and telling the states that they're on their own in administering the program. And you and I both know what will happen if we block grant Medicaid. Either we're going to redefine eligibility, or we're going to redefine the benefits that will be given to recipients, beneficiaries of Medicaid, or we're going to cut reimbursement. States will cut reimbursement to providers to Medicaid patients. And so this is very critical. We need all hands on deck because if we go to sleep, if we sit down and not pay attention and not be engaged in the 2018 budget and beyond, you will see programs cut that will hurt people that you care about so much and that I care about as well. And so on behalf of the 700,000 people that I humbly represent out of the state of North Carolina, I welcome you to Washington and thank you for your extraordinary service on these important issues. Thank you very much.
Good afternoon, ladies and gentlemen, and I have the honor of introducing our award recipient for the Chairwoman's Staff Leadership Award, and this award will be presented to Virgil Anthony Miller. Virgil currently serves as the Chief of Staff for United States Representative Cedric Richmond, a member of the House Committees on Homeland Security and the Judiciary. Virgil has supported Congressman Richmond in building his Washington, D.C. and district offices from the ground up. Now, what's of significance to this audience is that Virgil was very instrumental in the passage of the Affordable Care Act, signed by the President in 2010. He also played a leadership role in securing passage and enactment of historic food safety legislation in 2010. His legislative portfolio included healthcare reform, Food and Drug Administration reform, and Medicare and Medicaid policy, in addition to other key health policies. He's a native of West Palm Beach, Florida, and he received his Bachelor of Science in Biology and a Master's of Public Health from Florida A&M University in Tallahassee, Florida. So please join me in welcoming Virgil Miller. Our next award is going to be the Chairwoman's Corporate Citizen Award, and this is going to be presented by Dr. Puckrein. Here he comes.
I was back there talking to our honoree, who I've known forever. Our children went to school together when they were tiny, so it was good to catch up for a moment. Chaka Burgess is co-managing partner of Empire Consulting Group and has nearly 20 years of experience in public affairs, coalition building, lobbying, and also development for corporation, trade association, and nonprofit organizations. Mr. Burgess is the former Director of Global Government Affairs at Amgen, where he represented the company before Congress and the administration. In this capacity, Mr. Burgess was responsible for strategic outreach to advocacy organizations and led Amgen's effort to implement health disparities outreach strategies and community outreach issues for the company. Mr. Burgess has also worked in the Federal Government Affairs Division at Eli Lilly and Company, where he represented Lilly's interest on a variety of healthcare issues. He also managed the Division of Health Policy and Medical Legislation at the National Medical Association, where he oversaw the management of national and state government affairs, healthcare policy, and grassroots communication activities. Mr. Burgess is a graduate of Howard University in Washington, D.C., with a degree in public administration and public policy. He currently serves on several advisory boards, including the governing board of the Congressional Black Caucus Foundation and the Congressional Black Caucus PAC and the NAACP Foundation. A remarkable achiever in health advocacy and equity fights. Let's give him a nice round of applause to the recipient of the 2017 Corporate Citizen Award, Mr. Chaka Burgess.
Thank you, sir. That was pretty good.
Yeah, I'm doing my best.
Thank you. Well, good afternoon, and thank you, Gary. Gary is absolutely right. Our kids went to school together when they were that big. They're not so small anymore. They make us look small. But I want to thank National Minority Quality Forum and the Health Braintrust for this recognition. I've spent the better part of my career working on issues of health disparities and working to achieve health equity. And throughout that time, whether on the advocacy front with the National Medical Association, as an employee of pharmaceutical and biotech companies, and now representing a number of health interests, the Congressional Black Caucus Health Braintrust and the National Minority Quality Forum have been there as advocates and leaders in this space. And so I humbly accept this award, and we'll continue to work with them to, as I like to say, do well by doing good, and continue to work to achieve health equity in our lifetimes. Thank you very much.
And now, I would like to introduce the moderator of our lunchtime town hall on the state of minority health in America, Mr. Brandon Garrett. Brandon is a managing director at Paladin Healthcare Capital, and is the former chief of staff to Congresswoman Robin Kelly. He's a former executive director of the Congressional Black Caucus Health Braintrust, and prior to that served as a legislative director to Congresswoman Marcia Fudge of Ohio, the policy director of Congressional Black Caucus, of the Congressional Black Caucus, and as a staffer to the Ways and Means Committee member, Congressman William Jefferson of Louisiana, and as a policy director to Vice President Joe Biden. Immediately preceding his work with Congresswoman Kelly, he worked with former Vice President Joe Biden as his policy director and political advisor during the 2012 Obama-Biden re-election, working on debate preparation and rapid response and political outreach advisor for the inauguration. He's originally from the greater New Orleans area, and he attended the undergrad at Texas A&M University, graduate school at North Carolina State University, and attended law school at Louisiana State University, as if that's not enough. So please welcome me, and joining our moderator, Mr. Brandon Garrett.
Thanks so much, Audra, and I'd like to welcome our panelists, our distinguished members of Congress, to the stage. We'll give Congresswoman Kelly, Congressman Jeffries, and Congresswoman Sheila Jackson-Lee a minute to get up here before we start this talk. just waiting on Congressman Jackson. Okay. All right, well, good afternoon, everyone. Good to be with my old bosses, and to have this lively discussion with you all today. Instead of me introducing them, I'd like them to introduce themselves and kind of tell all of us their health priorities in Congress as we speak to this distinguished audience. So, Congresswoman Kelly.
Well, you guys have heard my name over and over and over. I'm Robin Kelly. I'm the Congresswoman from the 2nd Congressional District of Illinois. So I actually start in the city of Chicago, but I'm truly urban, suburban, and rural. So I go, for any of you who know the Chicagoland area, all the way to Kankakee County. So I actually have over 1,200 farms in my district, too. So it's a very, very diverse district, but all parts have great concerns about health care. And I know one of the participants got up and talked about the new person that's the Surgeon General, but as anyone that follows me knows that gun violence prevention is my passion and near and dear to my heart. And as you know, because of all the things that are happening in Chicago, so I do look at it as a public health crisis big time, and think we need to do as much as we can because we're losing a generation of young people. So that is one of my priorities. I am the co-chair on the subcommittee of technology, so I'm very interested in telehealth or telemedicine also, and always interested in diversifying the medical pipeline. Thank you.
Thanks, Congresswoman. Congressman Jeffries.
Good afternoon, everyone. I'm Congressman Hakeem Jeffries. I represent the 8th Congressional District, which is largely based in Brooklyn, a few neighborhoods in Queens. I'm at the beginning of my 3rd term. It's been an honor and a privilege to serve with Congresswoman Robin Kelly, who's done such a tremendous job as our fearless leader within the Congressional Black Caucus on all issues related to the health and well-being of our community. Many of the neighborhoods that I represent in Brooklyn, Bedford-Stuyvesant, parts of Brownsville, East New York, west end of Coney Island, for those of you who may be somewhat familiar with many of the neighborhoods in Kings County, have some of the highest rates of various forms of illness and ailment, particularly amongst African American men. Disproportionately high rates of certain forms of cancer, heart disease, respiratory illness, childhood, obesity, HIV, infection, and the list goes on. And as many of my colleagues, from my vantage point, all that we can do to improve the ability of people to live longer, healthier lives, particularly when we know that many of the illnesses that impact our community, we can positively impact as it relates to better primary care, better access to healthier food, changes in diet, better exercise regimen. And so collectively, I would just say that what's most important to me is to improve the access to high-quality health care, as well as to change lifestyles in a way that would greatly improve the ability of African-American men, African-American women, African-American children to fulfill their potential and be able to pursue the American dream, absent illnesses and ailments and afflictions that we know are largely preventable.
And from the great state of Texas, Congresswoman Jackson Lee.
Thank you so very much. It's a pleasure to be here with our chair of the Braintrust and my colleague from New York. Thank you for having me today. My name is Sheila Jackson Lee. I represent the 18th Congressional District in Houston, Texas. I've had the privilege of serving in the United States Congress for a period of time. I am a senior member on the Judiciary, criminal justice ranking member on that subcommittee, crime, terrorism, and investigations. And so we are in the weeds of what is going on here because, not in this room, but in this town, because there may be a crime that has been committed at the highest levels. That is not the topic today, but I couldn't help with that editorial comment. I'm a senior member on Homeland Security, and so it overlaps health concerns, and I am now the chair of the Congressional Black Caucus Foundation, and we are so proud of the leadership that Robin has given over the energy, over the healthcare brain trust, and for all of you. I think I've been coming to this outstanding summit for a very long time, and so I'm delighted to be here for that. Let me finish by saying that I look forward to putting some pithy issues on the table. I am also a breast cancer survivor, so I look at things from a different perspective in terms of research. And then my state has been a state that has seen infectious diseases up close and personal. Ebola in Dallas and the Zika virus in Houston, Texas. We are a Gulf state. So I look forward to engaging you in some provocative discussions and as well some challenges that we need to engage in, because health disparities is alive and well, and it has to be one of the civil rights issues of the 21st century. I'm so delighted to be here. Thank you.
Thank you, Congresswoman. And Congressman Payne Jr., glad to have you here. We had all the panelists introduce themselves and just talk about a couple of their health priorities.
Well, good afternoon, and it's an honor and a privilege to be with you, and I apologize for my tardiness, but Amtrak was not, once again, not helping my situation, but it's really an honor and privilege to be here with my colleagues, and especially Robin Kelly, who's become my partner. We worked together for a year when we worked. What were we doing? A special order hour for the Congressional Black Caucus. But I am also a junior member of Homeland Security with my colleague Sheila Jackson-Lee, and Hakeem Jeffries is just one of the outstanding members of Congress, and who's like my brother, and really is making a name for herself in fighting for issues that pertain to our communities. My interest here and work has been around cancers, specifically colorectal cancer. I've become a national spokesperson for Fight Colorectal Cancer and have done many forums and issues on that, how it impacts the minority community specifically, and the rates of people who succumb to that dreaded disease. And it actually is the second most curable cancer, and more people succumb to it in this nation than any other cancer. So those are the types of things that I'll be talking about as we get into the forum. Thank you.
Well, thank you all. All right, the way we're going to do this is I'm going to ask them just a couple of questions, but I want the audience to participate much more, and I want you to get up to the microphones and ask these questions. But point of clarification, I want a question, not a statement, not a thesis, not a dissertation, just a quick question to ask these members of Congress so more people can ask questions. So thank you for the amen. I appreciate that. All right. So my first question is, and only question is, with the election of 45, we have honestly seen more people engaged in the shared interest in public policy, particularly protecting things that we currently have, ACA being the main one. In fact, just this past weekend, there was a March for Science. So we've seen more people interested in participating and whatnot. Outside of the very public marches and presentations, what are some ways that the community can engage with you all to fight for the things that they want to see?
Whenever I speak in my district, one thing I do is thank my constituents, because really you guys were the wind beneath our wings. I've never seen so much public engagement, at least not for a very long time. So one thing I guess I would thank, as Brandon says, 45, for that people have stood up, resisted. We've heard your voices. We heard your voices so much that some of my colleagues on the other side took their phones off the hook. You jammed up their fax machines. You've done wonderful at their town hall meetings. So he's encouraged all of this resistance, but also it goes back to, we have to remember when election comes, no matter if it's local, state, county, or federal, that we have to vote, because that's why all of this happened, because we didn't vote. And I can say from the state of Illinois, they call our governor Trump Light. He's another billionaire, and we haven't had a budget in 20 months. So I would just ask people what you've heard throughout the morning. You have got to stay involved. As Congressman Butterfield said, we cannot fall asleep. We can't just look out for our very needs. We have to look out holistically for everybody, because we have so much to lose. And when my partner in crime, Donald Payne, talks about cancer, there was a study, because of the ACA, there's been a 45% decrease in African American men, and we don't want to go the other way. We want to keep improving, and we need all of you to do that. Dr. Price needs to hear from all of you, and please don't forget that we voted to repeal the Affordable Care Act 65 times, and he was the major drum leader in that. So don't lose sight of that.
We've seen an incredible surge in activity since the surprise election of the 45th President of the United States of America and his inauguration. I think a lot of people were just shocked. How can it be the case that we've gone from our great president, Barack Obama, to a situation where Barack Obama has left the building and so has taken his place. And as a result, people who may not have been as tuned in, as engaged, as involved prior to November 8th have decided, based on the stakes being incredibly high, to get involved. And we need to make sure that we sustain that energy all the way through the possibility of a midterm correction in 2018. Now, we can't simply just rely on faith, although faith is the anchor for us getting through this storm. We know we've been through some situations in the past, and no one knows about adversity like the African American community here in the United States of America. And we know ultimately that even if we don't like the person who's sitting at 1600 Pennsylvania Avenue, God is still on the throne. But even if God is still on the throne, which we know to be an ecclesiastic fact, God also helps those who help themselves. And so as a result, as Congresswoman Kelly said, we have to make sure that we do what the First Amendment said is our constitutional right. Petition the government. Allow your voices to be heard at every single level: the city, the state, the federal government, your members of Congress, your senator, at City Hall, at the State House, because the stakes are incredibly high. And the only other point that I'd make in response to the question is, let's not take our eye off the ball as it relates to defending the Affordable Care Act. We did win round one, but this group has been obsessed with repealing and replacing the Affordable Care. We see it on the floor of the House of Representatives. It's been a clinical obsession. They need medical intervention. And we know it has something to do with the fact that it was Barack Obama's signature achievement. Right. So they're going to take another run at it again. But as Abraham Lincoln said, public sentiment is everything. With it, nothing can fail. Without it, nothing can succeed. Public sentiment is on our side. Let's keep public sentiment on our side.
Well, as the scriptures have been quoted here so eloquently, let me just say my grandmother said, be busy until he comes. And that is what I hope that you will glean from this whole conference that has such a history and has had such great leaders to lead this conference ever since I came to the United States Congress. I know in this room there are health professionals, and there is a diversity, because even if you are a person of color, in your profession, you are going back to your respective home towns, working with health professionals who are diverse: doctors, nurses, public health leaders, hospital administrators. And so my view is of it that you cannot be silent. There are many attacks by 45, but the attack on health care is pronounced, blatant, and unsympathetic. And I believe it is crucial to ignore polling numbers, because over the weekend it's been pronounced that his small piece of the world is holding firm. He can do nothing wrong. But that does not include the many patients or constituents that you all serve in the health profession: clinics, immunization community, pharmaceutical community, doctors, and other health professionals, nurses. And so your silence has to be broken, not that you're silent, and you have to be arbiters of truth and fact. So in the Affordable Care Act, let it be known, the Congressional Black Caucus worked extensively on the issues, along with the Hispanic Caucus and Asian Caucus, on closing the disparities gap. You were very much a part of it. You helped craft that language in this forum. You also were advocates for increasing diversity in medical professions. And in the Affordable Care Act were dollars to increase those going to medical school and nurses. Many of you know that the medical school census for people of color, African Americans, has gone down. So we're not producing black doctors. So 45 is going at the heart of all the work you've done. $800 billion, I want to keep saying 880, but $800 billion taken out of Medicaid, $600 billion given to the fat and the rich, and an attack on eliminating the subsidies that would help people keep their insurance. What do you need to do? Go home and let professional language from a professional health professional, double use of word, speak to 2 or 3. You need meetings in your church, in your schools. We do town hall meetings, but we're away. Have meetings and invite us, because you're in a crisis. The NIH, we have just begun to get them to do clinicals with people of color. Triple-negative breast cancer hits women of color more deadly than other women. It hits Hispanics and African Americans. You're diagnosed with triple-negative breast cancer, your ability to survive is shortened. The people who were impacted by Zika, in most numbers, were minority: Puerto Ricans and the Africans who are here in this country. So I think we have a task, and it is to fight back and to stand up and say, I'm not going to take it anymore, because your patients are the ones suffering. Attack on Medicare, Medicaid, research with the NIH, Centers for Disease Control, and stopping our young people from having the resources to finish or complete their education in the medical profession. Less of all of you. And so the boxing gloves needs to be on, and I know that we will be prepared to do it, and we will be working with you, and your wonderful chair of the Braintrust continues to work throughout the year, and we will continue to partner with her to put on our armor to say, not on our watch. Testing.
Well, I'd just like to echo the sentiments of my colleagues in terms of him and say that we really are in a crucial place in terms of health care in this country with him in the White House, because he has obviously no care about what is happening in communities of color. We know that. He does not have any care for what's happening with people that aren't of his financial means. So everything that he does, and that's why we have to watch all of this tax reform talk, is who is going to benefit from that? Not a lot of us, unless some of y'all are in here and have a mansion and a yacht, But, we have to continue to definitely support the Affordable Care Act, as my colleagues have said. I was very concerned at one time about it, but I think, knock on wood, they didn't have the votes before 45 got there to get to repeal, and the program is getting more and more popular by the weeks these days. And you look at some of those Midwest Congress people that are having those town halls, people are asking, well, what are you going to replace it with? Now at least they're asking. Before they wanted it replaced, but now they're saying, well, wait a minute, before you take away what I have, what do you have to replace it? And they can't answer that. And so then people say, well, then don't touch my health care. So hopefully we get to a point where the Affordable Care Act is so popular that they'll stop talking about it and let it do its thing. Are there areas where it needs to be tweaked? Any program that large in this country has to be tweaked. Social Security went through it. Remember Part D, with the donut hole. Everything of this size it takes in this many people is going to have issues and needs to evolve. And that's the job of the United States House of Representatives, to help it evolve so it is something that is beneficial to all people. That old poll where they ask people, well, what do you feel about Obamacare? Oh my God, you got to get rid of it. It's the worst thing in the world. Lord, geez, please, no Obamacare. But what about the Affordable Care Act? Oh, well, that's a good program. I like that. So, that goes to say where we are with some folks in this group. But we know what it means in minority communities and people of color, and we have to make sure that it stays in place.
Thank you so much. Remember, if you have a question, please go to the microphone and ask it. I'll go ahead and let this young lady ask her question because I was going to reference the question she gave me yesterday. So go ahead.
So I figured you were doing that. Hi, I'm Dr. Fatima Cody Stanford. I'm an obesity medicine physician at Massachusetts General Hospital and Harvard Medical School. So one of the issues, obviously, that's pertinent to minority communities is obesity. Specifically, 60% of African American women in the United States have obesity. So my question to you as persons that are here representing the Congressional Black Caucus is what are we doing on the congressional policy level to address the high levels of obesity rates in our community?
Well, you and I had this
Yes, I love that,
conversation
yes.
yesterday because we were talking about a specific group of people, but I was speaking to a group of people in Chicago, and they did a study, and they named 5 neighborhoods where 50% of the African American women, I think, but black and brown, 50%, it wasn't they were fat, they were obese. And the person behind you knows. And then some of the other problems that came with that as far as pregnancy and just stress and on and on and on. And I did the Kelly Report on Health, and one thing I've been talking to my staff about is when you look at the top 10 diseases, and we are number 1 in 8 of them, that so many of them are connected with being overweight or how you eat and that kind of thing. We have put together health fairs all over the United States, and part of the health fairs have been some around weight, not all of them, but I do think we need to have more discussion, but it's tricky discussion, more education, because there's so many things, as you know, that go into it, as far as food deserts and too many of the neighborhoods, or even, generational or lack of knowledge about what you should eat and shouldn't eat. And in some of the neighborhoods in Chicago, people are too afraid to walk around the block for exercise. So there's so many things that go into it. So I can't tell you, there's one policy that I'm working on that's
What about the Treat and
pulling in
Reduce
everything.
Obesity Act, which has been introduced? This will be the 3rd Congress that's been introduced, and are any of the members of the Congressional Black Caucus supporting the Treat and Reduce Obesity Act, which is specifically to uncover intensive behavioral therapy for the treatment of obesity, meaning multidisciplinary, using dietitians, other professionals to help with nutrition, also coverage for obesity medications or anti-obesity medications. Those are some of the key tenets of the Treat and Reduce Obesity Act. So has the Congressional Black Caucus come out in support of that? What are some thoughts about that specifically?
Not that I know of as a whole. People might have individually come out, but I'm not sure. We haven't come out as a whole caucus.
Any thoughts?
Well, I think you have to look at the Congressional Black Caucus as a huge umbrella.
Right.
You represent one of the spokes in the umbrella that provide us with the advocacy and the insight.
Right.
We don't usually take pronounced statements on all legislation, but we have members who are leaders on these issues. So you may be on energy and commerce, which has a pronounced responsibility of health issues, though it overlaps into appropriations or our special interests. So what I would say to you is a lot is being done by the Congressional Black Caucus, and a lot has been done under Robin's leadership in pointing out how we can be helpful. But by that very bill, I can assure you a letter from you or a letter from the sponsor of the legislation to sign on, that will be done.
Okay.
We're in some very troubling waters right now.
Absolutely.
And that kind of good legislation is a challenge, but as I said, it doesn't mean that we lay down our armor. Obesity is a disease, and I think it should be, and I'm not a physician, it should be treated as such so that research can be done, particularly with women of color or men of color, and provide the treatment that you've advocated for. I think you can go away from the microphone and be comforted by the fact that we agree 100% with that, and we will be collectively, as members of Congress and members of the Congressional Black Caucus, strong advocates for the legislation and for the treatment of obesity.
I love it. Thank you.
We might.
Sorry. Excellent.
At times, we might not necessarily have the detail and the knowledge on it, but as I said, Robin Kelly is our leader in this area, and she would bring this to us. But it's something that, at times there are different issues where the Black Caucus is not necessarily all together. We have members that represent rural areas. We have members that represent suburban areas, and a lot of us in urban areas. But there are times where you have to vote your constituency, and it might not necessarily be the same as mine. But on issues of health and obesity, that is something that collectively, once it's presented to us, it's a no-brainer, and we're all on board because we see and we know what it does to our community. So this is an issue that, we might not, as I said, come from the top of the caucus leadership, but as members of the Black Caucus, we all understand what it means in our community. So it's something that you probably have a lot of support on.
Excellent.
And lastly, in addition to what has been mentioned by all of my three distinguished colleagues, I think several CBC members are part of the Agricultural Committee and have consistently taken the lead in trying to make sure that we can increase access to information about the implications of a poor diet, particularly as it relates to communities of color, the African American community, and the implications that has for things like obesity, respiratory illness, diabetes, heart disease, and then making sure that we can create access to healthy foods in the midst of the food deserts that exist in many of the poorer communities that we represent. And I think what's been striking for a lot of us, Robin Kelly has led the effort in the House, of course, support from great members like those from
Did you lost your mic? Your mic just turned off. Yeah.
Need a doctor to diagnose the problem.
Oh, I think it's still off. But there we go.
Here you go.
Okay.
There we go. Yeah.
So, Robin Kelly leading the effort in the House. Cory Booker, who's one of two senators who are African American members of the Congressional Black Caucus, really leading the effort in the Senate. And one of the points that Senator Booker has often made that all of us share is that more black men in our community lose their lives as a result of drive-throughs and not drive-bys. And while gun violence remains a problem that we are focused on with laser-like precision, if you actually look at the numbers in terms of the leading cause of death, you've got health disparity issue after health disparity issue that are on that list. Homicide, of course, is also within the top 5. I believe it's either number 4 or number 5. And so we've got to holistically tackle the problem, which is why things like what you've suggested in terms of the legislation will be something I'm confident we'll all take back and work to get behind.
Okay, thank you so much.
Thank you.
Appreciate it.
Dr. Lewin Johnson?
Thank you. Thank you to the panelists. I've been on Team Robin since she was one of 13 in a special election a few years ago. To my soror, I look forward to being in Houston next year. To Congressman Jeffries, we've been looking for your bio to see if you were a PK, a preacher's kid. And to Congressman Payne, when I was on the Board of Trustees at Chicago State University, couldn't say enough good things about how your dad was a champion for us in Congress. So thank you to you all. My question is, 2018 was referenced this morning earlier about things we could do in order to facilitate some change. And so I want your take on what can be done to facilitate some change in Congress in 2018. And right now, where do you see your leader, the Speaker of the House, where do you see him being at right now? And is he threatened by hopes of him being out of that position next year?
Testing. Well, that's a a mountain full, and it's dumped in front of senior mother here. So I'm going to try and carry it as they smile and say, right, we put it in front of. Though my age is counted backwards, and I started here in Congress when I was 12. But anyhow, in the course of saying that, what I can say to you is that there is a push and an effort and a reality and a possibility that Democrats can take back the House and make a big dent and maybe take back the Senate. We have to be optimistic in that way only because it really is not about us. It's not about the CBC, it's not about the Democratic Caucus or independents or Freedom Caucus or anyone else. It's really about what is good for the American people. Obviously, if we take back the House, we will have another speaker. Leader Pelosi, who was the speaker in the Congresses as we left the Bush administration, entered into the Obama administration, has on her record as the most successful tenure of passing more legislation to help more Americans. Clearly, with President Obama, we passed the Affordable Care Act, which did a lot for everyone, no matter what your economic status. So I frankly believe that our job is to put real facts versus fake facts and continue to narrow the population that just doesn't get it. And I'll just use this example as I close on the fact of what we're going to do. So that means that the present speaker would not be in place if we were successful. And we're only going to be successful if we can tell the facts about our colleagues on the other side of the aisle, that they are big spenders. And so here's the example. President Obama asked for $1.9 billion for the Zika virus. If you take an assessment of Puerto Rico, you'll find that there was devastation or an enormous impact by the Zika virus. He could never, and we could never, and we fought, get them to pass as an emergency supplemental. That means it doesn't go against the deficit, a $1.9 billion. But yet, 1 year later, after promises of Mexico paying for it, the deficit building, debt growing friends on the other side of the aisle are capitulating or making the point to pay for a wall. That's the distinction with us taking charge. And we've got to have you be part of giving the facts as to what we stand for and what difference it makes. Elections matter in 2018.
Thank you. Anyone else? And I just want to give one more comment. I'm with the AMA Minority Affairs section. In 2015, AMA did pass policy stating that obesity is a disease. And so some changes that have come forward from health insurers since then has been because of that. And hopefully that will help with the question of my colleague who was just before me, who's also a member of MAS, also in terms of helping getting that legislation forward. Thank you.
Thank you. Ma'am, you have a question? Okay.
Hi, I'm Deanne Hart. I'm a psychiatrist in Minnesota. I won't say who I work for, but right now there's the lowest in decade, the number of federal prisoners. So I'm concerned about the trend going upward. And I'm also concerned about how those who are involved with the criminal justice system will be impacted if the Affordable Care Act goes away. And also the reentry programs that Obama put in place to help people when they leave those institutions. So I'm wondering if you have any thoughts about those who are involved with the criminal justice system.
Well, mass incarceration and its adverse impact on our community is really one of the foremost civil rights issues of the day. We know that when the war on drugs was inappropriately declared by Richard Nixon back in 1971, he called drug abuse public enemy number one. There were less than 350,000 people incarcerated in America. Today, there are more than 2.1 million. We've got 5% of the world's population, 25% of the world's incarcerated population. And there are countries out there that we view as oppressive with respect to civil and human rights. Russia and China, you take their population that's in prison, combine it together, it still doesn't equal what we've done here in the United States. And we know that the majority of people who are behind bars disproportionately are African American. And thankfully, this is an issue where the CBC has been at the forefront across the spectrum as it relates to reentry, as it relates to making sure that there's adequate, humane treatment within the context of the correctional environment. And Sheila Jackson-Lee is our fearless leader on this issue. She's the lead Democrat on the crime subcommittee. And there is a bipartisan effort underway. This is one of the areas where my colleagues on the other side of the aisle have achieved some enlightenment and recognized that the criminal justice system is broken and have begun to work with us in a bipartisan way. We were hoping, and Congresswoman Jackson-Lee can talk more about it, that we could get some criminal justice reform over the finish line in the final days of the Obama administration. The earthquake that happened on November 8th changed all that, but we're still going to keep our foot on the gas pedal. We're still going to try to advance the ball, and I am confident that in time we'll make some progress in this area.
Thank you, Hakeem. All of us can take credit in the advocacy, and I thank Congressman Jeffries and Payne and Kelly. Doctor, this is where you can be crucial in your advocacy. Congressman Jeffries is absolutely right. We were on the precipice of signing legislation that really incorporated all that you were saying. Sentencing reduction, prison reform that would have sensitivities to mental health and anger management and parental on the federal level, which could be the bully pulpit. As you well know, President Obama did a lot of commutation of sentencing, but he also was an advocate for issues dealing with mental health. I'm a big advocate for dealing with post-traumatic stress disorder, which means that you could be in the military, or you could be a victim of crime, or you could be a perpetrator of crime and be incarcerated and need to be rehabilitated. So what I would make the point to you is that we lost the momentum, not the advocates, because there are Republican and Democrats who are still pushing for it, when the word that came back to us is, well, you know, there's an election and we want to see what he will say about it. Well, that has not been saying anything about it. And so it's very important. We have these bills moving in judiciary. We did some great things with opioid, changed it from punitive to treatment, but we have some steps backwards. The Attorney General is now looking askance at Washington, D.C., which has decriminalized marijuana. My county has decriminalized marijuana in certain amounts. That goes a long way to decriminalizing individuals who are being incarcerated. It also goes a long way regarding treatment of individuals who may be suffering from, this is not characterizing marijuana use in mental health, but may be needing treatment in mental health if you're criminalized. So the Attorney General now wants to stop jurisdictions from doing that. So there needs to be a rise up and continued work with Republicans and Democrats who said last year that they believed in criminal justice reform tied into making sure that incarcerated persons have treatment, their families have treatment, their children have treatment, as relates to mental health needs that they may have. So your voice is going to be very important. I can assure you that we will not be silenced, and we're going to continue to work. We're looking to pass some legislation. The question is, pass it for it to be respectable and responsible, and for it to be signed. We need your advocacy.
Thank you.
Question?
Yes, so, this is Dr. Siobhan Westcott, and I want to give a shout out to the pipeline programs, and I know times are tough. This is not going to be easy, but we have to think long haul, because there are probably over 200 people in this room. That's more than there are native med students in this country. What did you say? That is more people in this room than there are native med students in the United States. As well, I'm an Alaska Native, I'm Athabascan. I'm one of 2 physicians from my tribe. It's me and Donna, that's it. So I know that there are a lot of problems that we have to deal with, but if we don't get the pipeline going, and I don't mean by oil, because I'm in North Dakota, so that's another issue. But, we've got to get those bright students interested and involved.
Thank you. We only have a few minutes left, so we're gonna get all three questions first, and then we'll let them. Okay. Go ahead.
I was actually, you were in line first.
Okay.
I'm a Howard man, so ladies first. Please.
Oh, I appreciate it. My name is Caitlin Denny, and I'm the executive director of a local free clinic. My population is caught in between those that can access Medicaid and those that can afford the ACA at a level that works for them. Behavioral health is becoming a piece so mandatory as a part of primary care, and as we look at our communities, and as my patients come in, they're seeing more fear, and we're seeing the effects of stress in the body, and at my level, we have no access to behavioral health care. The question before me previously addressed in brief behavioral health care, but what's being done in the pipeline now to affect those folks caught between ACA and Medicaid, caught in those communities who are perhaps becoming aware of issues they weren't before if they come from a point of entitlement. But what we can do for behavioral health care and continuing to advocate for its access at all levels, not just for those that have the ability to afford insurance.
And then I'll finally ask, so thank you all, members of Congress, for coming and for your advocacy in support of this forum. My name is Ray Bignell. I am a pediatric nephrologist at Cincinnati Children's Hospital in Cincinnati, Ohio. My primary question, so I've been involved in advocacy efforts locally and nationally for the last 6 years around a variety of topics in pediatrics and pediatric kidney disease. But I'm particularly interested in being sort of in the middle of a very red county, in the middle of a very red district, in the middle of a very red state right now. I'm very interested in knowing what areas of partnership and cooperation in health and even health disparities you see as things that I could advocate for effectively amongst my colleagues and individuals in my area who might not be of my political persuasion. And so I would be interested in your thoughts on that. Thank you.
All right, so we have three different topics to address. This will be the last one.
There we go. Okay. Thank you for being here and gracing us with your presence, and we appreciate what you do in advocating for our patients. My name is Frank Clark. I am a psychiatrist. We kind of roll deep in the American Minority Affairs Section of Governing Council. But one of the things that has been, I'm passionate about, I serve in a rural area in Southwest Virginia, but I see a lot of inmates who have done the time, and then they are released, and there's no type of rehabilitation for them. We all know that the new mental health hospital is the jail or prison, and so a lot of my patients have not only a mental illness, but a co-occurring substance use disorder. And when they get out, the themes that I hear, doc, I can't find a job, I can't vote. And then we are upset when we say, well, why are they reverting back to the same behaviors that got them in prison to begin with? And my thing is that we're not doing anything to provide that rehabilitation, to provide that recovery. We have a lack of resources for substance use. In my personal opinion, if you've done your time, you've been changed, you should be able to have a second chance. And I wanted to know if there's any legislation on that, on rehabilitation programs for our inmates regarding their mental health, their physical health, their spiritual health, and just the whole shebang. Thank you.
All right. So we have 4 topics that we're going to cover. Let's see if we can address them all. Start with Congresswoman Kelly.
A few. The first one, as far as the diversity pipeline, I know when I've met with people that have newly graduated from medical school or doctors or even dentists, they talk about just the cost of going to school, interest rates, and I was shocked. I think Neva was in the meeting when someone said they had a $400,000 dental school bill. So I think that's, we have to look at the cost of college and going beyond. And also we have to look at, in my district, I started a STEM council and a STEM academy because not enough young folks were even putting themselves in position as far as science, technology, engineering, and math to qualify to get into colleges or med schools or things like that. And I think we try to expose our young folks to really role models so they can see themselves in those positions. So, that's one thing. The other thing is, I think it's really important, even if you're in a red state and you might be the only Democrat, to also have healthcare roundtables. That's something that we're starting. And, they may have ideas of, they may not like Obamacare, but I would like to think every doctor wants their patient to have health care, and what ideas would they have? Because also, despite what some of us might think, we don't know everything, and we don't have all the ideas, and we need to hear from professionals, or in this case, doctors, nurses, radiologists, psychologists, psychiatrists, about what is needed, because you're in that field every day. You're talking to your patients every day. So I think Sheila said, so we're depending on you to give us information, but starting a healthcare roundtable, inviting from your state rep, state senator, your congressperson, or your senator to the table, as long as they don't feel like it's going to be a hostile environment, and you tell him or her it's bipartisan. I do think the moderate Republicans, I've been here 4 years, I was special election, so 4 years in April, and this is the first time I've really seen moderate Republicans finally rise up to how they really feel. So we need to stay on them to make sure that they do that, because it wasn't just the Freedom Caucus, it was them that helped stop the Affordable Care Act, with our help in calling them out, and the public's help in coming to their town hall meetings. But, have roundtables and invite your representatives in a bipartisan, safe environment.
Well, in terms of, I think the final question, as it related to mental health services and access to individuals who may have come through the criminal justice system and are back out into the community, we certainly have to work to increase access in our community writ large to mental health professionals. In advance of someone getting caught up in the criminal justice system, within the context of the criminal justice system, and afterward in terms of promoting successful reentry back into our society. It seems to me, and Congresswoman Jackson-Lee, I think, and Congressman Payne also may have alluded to this point, that, when I visited Israel, there's a part in the southern part of that nation called Sderot, which is immediately adjacent to the Gaza Strip. And there's a lot of conflict there between Hamas, which controls the Gaza Strip, and missiles flying into Israel and the back and forth. I'm not trying to get into the conflict. But what I was struck by is that in this neighborhood in Israel, Sderot, along the southern Gaza Strip border, they recognize that the children there, who from time to time have to flee into bomb shelters when the missiles start flying, are impacted by the possibility that their lives could be ended by the violence that they see, or just the stress of the day-to-day experience. And it seemed to me, and so they have individuals, mental health professionals, and significant intervention as it relates to post-traumatic stress disorder. Whereas in many of our communities, in some of the neighborhoods I represent in Brooklyn, Fifth Ward in Houston, South Side of Chicago, Brick City in Newark, we've got young men and women or children who have to live with the same level of stress and fear and anxiety that at any moment when they leave their homes, their lives can be taken, the lives of their loved ones can be taken, and there's no comparable mental health intervention to deal with the adverse impacts of living with that level of stress and anxiety. And that's something that I know is important to the Congressional Black Caucus and will be part of our agenda moving forward so that our children, our young people, can live the healthiest lives possible.
Well, let me do a little bit of advertising and just associate myself with all of the work and words that have been said here today. I want to give 2 points as I quickly, CDC report in 2016 on HIV/AIDS, which I may have missed it being mentioned, indicated black heterosexual men, there was a 1 in 20 lifetime risk compared to a 1 in 132 lifetime risk for white heterosexual men. But as it relates to gay black men, 1 in 2, 50% of gay black men have a lifetime risk of HIV. So that lays the groundwork for the kind of activism, first of all, that we need. And so I would just say, Doctor, one of the greatest audiences that you can have and find, and they'd be so excited to see you in places of worship. And you could make yourself really the pronounced leader on lecturing, being a guest speaker, being at their health fairs, convening pastors, and talking about health care as you see it. And I think you'd be a great asset, even in a red county or state. But more importantly, your congressperson, red or blue, represents you. And you have every right to engage them in issues. Let me say on the pipeline, I will join with Congresswoman Kelly and say, however we lead, we will work with you. Those numbers must go up, and it is frightening. To the behavioral treatment, that is crucial. Again, I cannot emphasize enough that we are in a crisis. What we had last year under President Obama is not what we have this year. But one of the advocacies of the Affordable Care Act is federally qualified health clinics. And we can begin to turn people toward fee-for-service to fill in the gap while we are working to save the Affordable Care Act and also to improve it and expand those who can use it. We were able successfully to get mental health behavioral issues in, and then you have to work with your educational institutions. The school districts cannot abandon children who need behavioral treatment or special classes, which is a challenge across America. So I hope you will engage and collaborate. I'm not sure whether you're with a federally qualified health clinic, but those are part of the tools that we utilize in the ACA. And then to the gentleman, I do want to say and join and associate myself with Congressman Jeffries, but watch the progress of the Second Chance Act. That's one of the bills by Congressman Danny Davis that we're trying to reauthorize, and that had all of the elements of second chance for those coming out. Treatment, job opportunities, sort of a support system that you would get. Now, my last advertisement is please support HR 1784, I think the number is, HR 1984. That's the triple negative breast cancer bill, and advocate to your members of Congress to support it, get on it, and let's pass it. And I thank you so very much for having me. Thank you, Brandon.
I think as far as also, as far as also in Chicago, there's something, an organization called the Safer Foundation, and I would recommend that you get in contact with them because they have been very instrumental in giving second chances to people getting out of jail in a holistic way. So it's called Safer, S-A-F-E-R Foundation.
Yeah.
Congressman?
Yeah, thank you. Earlier when Congressman Jeffries was, making answering your question, he talked about, with people with high blood pressure, hypertension, and heart disease and diabetes. I was going to ask him why was he talking about me, but I resemble that remark. Which brings me to the point. I'm the co-chair of the Men's Health Caucus in the Congress, and we do a lot of work and workshops and seminars where we get information out to different locales in terms of men's health. In the last 100 years, the lifespan of men has declined as opposed to women. So there are a lot of issues that we have to deal with around men's health. One being first to get them to see a doctor. that would go a long way in helping a lot of these issues. But we are a resource as well. To the doctor from Cincinnati, I would write your member of Congress and ask him, is he a member of the Health Caucus, which will allow interaction with the Congress, the members of Congress that are in the caucus. And all of you should ask your members of Congress, are they members of that caucus? Do a lot of good work. We need your input as well, which allows us to create the legislation that is important to you, to our communities, and to this country. So, thank you.
All right, well, I'd like to say one last thank you to our panelists, these distinguished members of Congress. You guys don't know how much effort and time it takes to just get from one side of D.C. to the others, because they have to do things like vote and take care of 750,000 constituents apiece. So we really thank you for your time here, Congresswoman Kelly, Congressman Jeffries, Congresswoman Jackson Lee, and Congressman Payne Jr. We really appreciate your time, so thank you. As they take their pictures and whatnot, we're going to keep the show running. In just a moment, we'll have a screening of the immortal life of Henrietta Lacks. It's a very important discussion to have.
Joining us on stage is not only David Lacks Jr., he is the grandson of Henrietta Lacks and the son of Henrietta's middle son, David Sonny Lacks. And we have his beautiful sister, Jeri Lacks-Whye. She's the granddaughter of Henrietta Lacks, and she will be joining us as well. These two are individuals of the Lacks family who have taken upon themselves to hit the road and to share the vision and the legacy of their dear grandmother. Now I want to start by saying I've had the opportunity to watch the movie, and I have to say thanks as a almost 9-year breast cancer survivor and a personal recipient of the legacy of Henrietta Lacks. I have to first say thank you. The gift that Henrietta Lacks has left this world, put your hands together for it. I want to also thank the Lacks family, definitely to Jeri and David for joining us today for this discussion of the life and legacy of their grandmother, Henrietta Lacks. I have to thank my dear friend, Congresswoman Robin Kelly, for her leadership with the Congressional Black Caucus Health Braintrust and the National Medical Quality Forum, Minority Quality Forum, and obviously thanks to Susan G. Komen Health Equity Initiative for sponsoring this very important conversation. I have had the pleasure of knowing these members of the Lacks family for some time now and have had the opportunity to sit and speak with them and get to know them personally. And they are dear, wonderful people, full of knowledge, super intelligent, and have become two of the most significant patient advocates you'd ever want to meet. So I want to start this conversation off by posing a question. Jeri and David, we saw today an example of the way the world continues to recognize your grandmother, Henrietta's impact. How has your family worked to shed light on this very remarkable story?
Oh, wow. Well, I guess, like I said, it started with my Aunt Dale, who took on this quest, as you've seen, with Rebecca Skloot. Said she wanted the world to know about her grandmother and the ill cells, and that was more than the fact of cells. But as you see in the end of the credits, that Aunt Dale passed away 9 months before the book was published. So Jeri and the rest of the family felt it was our mission to continue what Aunt Dale started. She started something about she wanted the world to know what her grandmother's accomplishment was. So we just took it upon ourselves to do the same, to let the world know. But in the publication of the book came out, we got an opportunity to speak and travel and talk to students and address many issues. The book touched upon so many issues that, we decided, we really couldn't stop there. Like, the book is great, but now we got to take it to the next level, build upon what what our grandmother started, then Rebecca reported, and our aunt helped bring to life, and then now it's our turn to take the baton and take it to the next level by, like I said, being patient advocates, try to address many of the issues that are brought to light in this book so that it won't happen again, or just make it better for everybody. Because at some point in a lifetime, everybody's going to be affected by some medical condition.
Absolutely. Jeri, you have something special to share with us.
Asking how does the family, just make people aware of Henrietta. And like David said, we do the public speaking, and then I did the poem of my grandmother just to pass around so people can get to know her as a person. And I just wanted to read, you should have the copy, but I just wanted to read, this is a poem that I just felt dear to my heart that I needed to write to let people know who my grandmother was. And it says, "Who am I? As you gain knowledge, all will become clear. You ask, who am I? Be a daughter, wife, mother, or friend. I am just an ordinary woman, a wife to my husband, mother to my children, and a friend to the world. I became ill and departed this earth at an early age. Through my death, I became a medical treasure. I am the one who became immortal. Yes, the first immortal human cell line. Say the word, everlasting. I am the one who helped Dr. Jonas Salks. Yes, him and I saved millions of lives by creating the polio vaccine, the disease that killed and sickened millions of children in the 1950s. Say the word, immunization. Read about me. I am the one who was at the right place at the right time when a scientist accidentally poured a chemical on me. Yes, to their surprise, humans have 46 chromosomes in the human body, not 48, sorry. Say the words, genetic diagnosis, read about me. I am growing indefinitely, frozen for decades, shared among scientists, and remain the most widely used cell line in biomedical research. They say the word, divide and conquer, read about me. And it was more to the poem. I'm sorry that I kind of left that part out, but I just wanted people to know, the contributions that our grandmother, my father, and my uncle and my aunt, mother contributed to the world, and this was just a great honor for me.
And that was just a minute mark.
Yeah.
Put your hands together. Now, we all can agree that Henrietta Lacks made an invaluable contribution to science. What do you see as her greatest contribution?
Ooh, her greatest contributions, I really can't say one particular contributions because it seemed like her cells has contributed to so much. She has saved lives. She has made the impossible possible. And when I say that, as far as saving lives, as far as like the polio vaccine, she helped, with the polio vaccine. She helped with the in vitro fertilization. She helped with the HPV vaccine, influenza vaccine. She helped with in vitro fertilization. When I say make the impossible possible, she helped women who couldn't conceive. So it's just not one. I just think it's everything is the greatest that she has actually contributed to the medical world and to humanity.
Well, one of the things I would say was the value to her family. As in the movie, you seen how Henrietta took care of, the neighborhoods and people that came. And growing up with our family, my aunts and uncles, you seen that same value passed along. Even though they didn't get a chance to know her other than Lawrence, my family was always welcoming and taking people in and, cooking and sharing. I was like, I can see where the family get that trait from. It came directly from Henrietta.
Yes, I agree.
Now, your family have become very vocal advocates for patient rights, you would say, right? Now, why do you think patient advocacy and community engagement is so important to attaining health equity?
Well, let's see. I guess you could advocate for the patient because, like I said, in this movie, Henrietta was poor and, and African American, and Johns Hopkins was one of the few hospitals that would take her in. So, like I said, we fast forward to today, we still feel like a displacement between the poor, like the more successful, the more rich you are, the better the health you are, the longer you live. It actually was that's a report out that came out. I read a couple of days ago that said the richer you are, the longer you live. That's because you have access to better health. Better health care. So just want to even feel like we need to even the playing field because not everybody has access to that health care. Like I said, it costs so much money to, take medication. Some medications cost $300, $400, $500 a month that the average person may not have that disposable income. Whereas, some people with more influence can. Now, that's not to say that's a negative, just how can we even the playing field? So everybody could benefit from, cures and prescriptions and stuff like that. So you don't have to choose between eating and paying for your medication.
Jeri, do you have anything to offer?
No, I just wanted to just use my personal experience when it comes to community engagement and having that patient, I call it patient navigator, because I was sick like a couple of months ago, and I had a nurse who called me every week just to check on me, to make sure that I understood what the doctor was saying to me, what kind of medication I was taking, if I understood what the doctors was saying to me when I went for my follow-up visit. And I think that's a great way of communication and a great way for people and for patients to feel relaxed, for them to have a better sense of what's going on with their health. If you have somebody there that you can, it's like a go-to person that can help you out with doctor visits, help you out with understanding your health insurance, what's covered, what's not covered. So I think it's a great idea or a great way for people to have that engagement with the patient advocacy.
Agreed. And community engagement is a way for us to increase awareness and education within our communities. And advocating for patient rights will open up doors for us as patients to speak up about our health, to request and demand certain things about our health, and also create a vocality, if you will, within us to speak up and participate in clinical trials so that we know that the testing that is being performed, we are a demographic that is substantial to that study and would be able to know whether or not certain treatments that are developed would be applicable or would be available to treat us adequately. Now, we cannot thank your family enough for all of the persistence and your dedication in sharing, traveling across the country, advocating for patient rights, and the remarkable story that each of you share, and your sacrifice. It's been a tremendous sacrifice for what you and your family members have contributed to continue this legacy and to increase awareness and education. What can we do? What can we do to help your family? And what are the next steps on your journey?
I guess the next step would be for us to continue to speak about our grandmother's story, to make people aware of her contributions to science, her contributions to humanity, for us to do a children's book. We would love to, educate the young. We would like to do a coffee table book that's in the process of chronologizing our journey from the time that we found out about the book, about our grandmother up until now. We would like for people to actually tell Henrietta's story, and that way people will know her story by telling her story. We would like to have high quality health care for the Lacks family, even if it's not for the Lacks, the immediate family, at least for Henrietta's children.
Mm-hmm. I guess the main point is to build the ecosystem around what has occurred. Like I said, they had took Henrietta's cell and all this has come about of it. But now it's up to us to build around it. Like I said, list all the things that Jeri said, and also be a bridge between patients in the medical community, because I serve on the NIH board, accessing the HeLa genome, and I work with scientists all the time, as well as patients. We need to come together to, improve life for all around. So when we up here, we're not really bashing scientists, we're not bashing the doctors for what they do, because we all need to come together to work together to make things better. So like I said, we just want to build around what we have started with the continued speaking engagements and more.
Right, and then like,
you know.
oh, I'm sorry, go ahead. And like David said, no, I was just saying, like David had just said, building around what we already established and building partnerships. And David mentioned that, we built a partnership with NIH. 2 family members are actually on the committee. I don't know if you want to talk about that a little, about the NIH
Well,
committee.
we do want to have some time for some questions
Oh,
from our audience. Please feel free, if you have a question, step up to the mic.
So good afternoon. First of all, I just wanted to say thank you to coming and representing for your family. I am a scientist by training, and I am from Halifax County. So it's just wonderful to have more exposure to this story. I learned about this story when I was a PhD student, and I was just so shocked to find out that the cells I'm using in the lab to conduct my research was, how it happened. And so, as you just briefly mentioned about how to further engage and share your story, I was just wondering, what do you think scientists should be doing as well to continue to just keep this legacy alive for your family?
Well, I guess, like I said, you hit it how, like I said, you looked at the sample, and before you really didn't know the story behind it. But when you think about it, each cell, each kernel, each thing you use, specimen you use has a story behind it. Just know it came from people. But I guess the biggest thing is just to communicate with your patient. One of the things that happened with Henrietta, we feel that she wasn't communicated to enough. She really didn't know what was going on. And that was an indication of the times back then. They believe, doctors believe, that they knew what was best for you. And the patient didn't. But nowadays, that paradigm is kind of shifting. So if you could just communicate with your patients and know that they are real people, they have real struggles, real stresses. And I think that would be the best way you can honor Henrietta Lacks and carry on her legacy.
That's an awesome point that you bring out, because in medical school, I went to medical school between 89 and 93. HeLa cells, it was on practically almost every test we took. I had no knowledge. I, as a Black woman, have had a number of conditions that have been treated, that were successfully treated as a result of HeLa cells. As a breast cancer survivor, chemotherapy made available to me because of HeLa cells. And when it comes to patient rights and that paradigm shift, we need to understand and appreciate that at that time, things were done differently. And we have made such tremendous headway that we as minorities really need to consider that we have now earned the right. We have informed consent, we have IRBs. We really need to make a point of putting ourselves out there and making ourselves available for research so that this legacy can continue and we can receive the appropriate care and attention that we deserve. Please.
Hi, my name is Stacy Hunt. I'm a dermatologist from Northern California. So while I was sitting there, listening to the story, sometimes we don't ever think about the connection that we have. And so I was a recipient. I actually had my children through IVF, and I really didn't even think about that. And so part of my thing is that, is there a foundation that I could give to? Because I didn't even think about that. And to look at the 2 beautiful children that I have because of that science is amazing. And, sometimes people were like, well, are you sure? I'm like, you know what, because God made that type of, science available during my time, then it's just been such a beautiful blessing. And I just want to figure out, whether through a foundation, how to bless your family.
Thank you. Appreciate it. Oh, bless you. The Henrietta Lacks Foundation.
Thought about Rebecca Skloop,
right.
One of our other cousins. One of the things that, is, I don't know if it's touch point. Well, you've seen the picture at the end, how many Lacks family members there are. There's a lot of us, so each one of us are doing different things. One of our cousins, he just started the House of Healing, that he's doing some work, and we work with other foundations. So I guess just be on the lookout, and we'll go from there. Because like I said, there's so many things we do, and each one of the family members are touching on issues that's as close to them. Like I say, he's into transitional housing, and breast cancer. We have another cousin who's working on the educational issue, and I'm more one science person, so it'll be upcoming future. It'll be different avenues.
Yes. Yes, I'm Dr. Archie, Berthel Archie with the National Black Nurses Association and a professor at Bowie State University. I would like to ask you, are you interested then in doing, you said you're taking it to the next level, is that now you publish a book with the additional story, because you have an additional story to tell, and I know we all in this room would be very interested in a copy. I hope you will do that, so I want to plant that, if you're not already working on it, plant the seed. The other thing that concerns me, and you can share with me if this is true, that there are bioscience labs that continue to sell those cells to other research organizations and groups and realize significant remuneration. So can you, and I guess we're all concerned about the fact that the family has not benefited at all in reference to this. So I'm just hoping that there's something that can be done to correct some of the wrong that's been done. Thank you.
Any comment?
Well, I guess.
About the book first, what are your thoughts?
About the book first. We have not, we was just mentioning to Rebecca Skloot about doing a series, but not for her to do a series, for the Lacks family to do a series, just talking about our life after the book. So we haven't started there yet, but it has been a thought. But we was just talking about, the children's book, and we was talking about doing the coffee table book. And the coffee table book is already, being processed, but we still working on a children's book. As far as the being compensated, the family has not, nobody has came to the family and said they would give, anything. We try not to, not saying that we don't.
I know that's not your interest, but I hope some lawyer will look at this situation and come to your aid and say, something should be done. Thank you.
Yes, thank you. We hope so too.
Well, I have to give thanks to Jeri and David. This has been an awesome time, and it seems like there were some members in the room that were surprised. Okay, we have time for one last question.
Thanks, Siobhan Westcott. I just wanted to thank you for being here. There's a lot of people in this room who not only work with science, but we listen to our patients. We listen to our patients of color. And it's hard to get other people sometimes to care. So you're being out there, sharing your grandmother's story and continuing it in a new story just for you, that's unbelievably valuable to all of us. And we want to thank you.
Thank you.
Thank you.
I want to thank the Congressional Black Caucus and the Health Braintrust. Thanks to the National Minority Quality Forum. Thanks to Komen Health Initiative for making this discussion possible. I will let you guys know that at the bottom of the bookmarks that you see on your tables, there is contact information for you to be able to reach out to the Lacks family and get in touch with all of your wonderful ideas. As soon as you find that attorney, please call them. Please call them. And I want to give words of encouragement to David and Jeri and pass this on to the rest of the family. Continue going. God recognizes your efforts. He recognizes your humility. And He has placed a vision before you. And we know that in due season, please faint not, because in due season, we know that God has something great for you. Henrietta Lacks' legacy. You can put your hands together for that. Her legacy lives on not just because of the contributions that she's made to science, but I hope it continues to live on because something has been stirred up inside of you to say that this was done and is great, but there are some indiscretions that have not been addressed, and I want to do whatever I can to right the wrongs that have been done. And I want to encourage the family to keep on going, keep doing what you're doing, because your rewards may not come from where you're expecting them to come, but you will be rewarded. And your grandmother is definitely looking down and shining upon you, and is grateful that she has committed a legacy through her DNA that will continue to raise a voice and shout out for patient advocacy and for community engagement, so that we can live in a world where health equity is the norm. God bless and keep each and every one of you. Please, next family.
Everyone, if we can give one last round of applause for the Lacks family and their legacy. We're going to close out right now, and on behalf of Congresswoman Robin Kelly and the Congressional Black Caucus Health Braintrust, the National Minority Quality Forum, and more than anything, I want to thank everyone here for caring enough to take the time and get involved. So thank you. I'll see you tonight. And before I go, we have an autographed copy of The Immortal Life of Henrietta Lacks that the Lacks family and Susan G. Komen have been so kind to leave behind. And I want to offer that up to the first hand that I see. Proximity is power. So, so thank you all, and I'll see you at dinner tonight.